Good morning, everybody, and welcome. It's a great pleasure to host you here in this wonderful webinar. And today we will speak about Tixel. So I know we've had some webinars regarding Tixel, but Tixel is a versatile device. So I'm going to show you, to present to you my perspective of how Tixel fits into my clinic, especially nowadays in the COVID era. So let's get going. Of course, if you have any questions, don't hesitate to ask. We will answer all your questions at the end. So, my name is Lehavit. I am a dermatologist. I'm quite old, as a matter of fact. I have been practicing aesthetic dermatology for almost 15 years already. And I'm using a lot of technologies. I'm doing also regular dermatology and aesthetic dermatology, and I'm a big fan of technologies and of combination. And lately, in the last 2-3 years, one of my one of my favorite technologies is the Tixel. So we all know that getting older is nothing to write home about, and as a matter of fact, it seems like everyone wants a younger look. I mean, almost everybody wants to look younger. But sometimes I think that we just took it a step too far. And maybe, only maybe, that's one of the reasons we see a real shift in approach of aesthetic treatments. We are not talking only about volumization. We are not talking about only filling wrinkles. As a matter of fact, we are not talking about wrinkles almost at all. We are talking about proportion. We are talking about texture improvement. And most importantly, we are talking about natural results. All our patients today want a natural look. And just in few words, let's go over the changes that go over our face as we change, as we age. Well, we see a lot of changes of the face. Of course, the first thing that changes is the skin. So if we want to make it simple, there are two main things of the skin that change as we age. First of all, we lose volume, the face shrinks a little bit, but most importantly, and the second thing that happens as we age to the skin is that we have a reduction in the skin's texture and quality. And if we want to do good anti-aging, we have to take this into consideration. Of course, it's not only about skin. We know that aging is a multifactorial process. And if we take a look at this picture, the lady, the mother of Albert Dürer, who is a famous painter. This is his mother. Here she's 45. Here she's over 65. We all know that it's not only about the skin, and we also know that it's not that easy to get younger. And if let's think about what our patients want. Our patients want to look better, and this is what they do not want anymore. Our patients do not want to look like that, but rather close your eyes just for a moment and listen to the harmony by Mozart. This is what our patients want. This is what they need. And this is what we have to create and to give to them. So our treatment target, if we want to simplify things, is of course to redefine, to restore volume, to improve wrinkles. But as I told you, one of our biggest targets is improving the texture. The skin itself loses its vitality as we age, and we have to take that into consideration. And how do we do natural anti-aging? Well, basically, it's all about proportion because we know that the basic structure of the face changes over time, and every one of us has his ideal proportion. We need to maintain that. We need not to lose that. Take a look. Correct proportion is timeless. Take a look at the picture at the picture with the girl with the earring, and take a look at the princess from England. They both have the same correct proportion. And proportion is almost everything. This is crucial. But it's not only that. We need to maintain a natural look by using combinations. Why do we need a natural look? Not because I said so, because our patients are afraid of fake look. And that is the biggest barrier that causes them not to come to make the treatment. So we're talking about combinations. Combinations mean that every patient wants almost the same thing, but the way to achieve it is different from one patient to another, because we need to relate to our patient as art creation. No same template for everybody. So I've been talking and talking about combinations, and not only me, but I am a big fan of combinations for many years. So I ask myself, or as a matter of fact, my husband, who has to pay for all the devices that I buy, ask me, why do we need to combine? Why not use the CO2 laser which stands right here to do everything? Well, our patients today are looking for treatments with less downtime and with less side effects. And because of the improvement of technology, we can give them that. We can give them improvement. We can treat them non-aggressively and still get good results without downtime and without pain. And also combination enables us to tailor the specific treatment to our patients. So yes, we do have a lot of options, and yes, we have a lot of devices in the market, but we need them. We need all of those devices because we need to personalize the treatment. Every patient is unique. Keep that in mind and look at that list. We have a lot of challenges and targets and a lot of things that our patients want from us. And in all, they want the holistic approach. Again, we're not looking at a specific area, but looking at the whole person, at the whole skin, and not only the skin of the face. The skin of the face is only a part of it, because a person cannot go with a face of 40 and a neck of 60. Again, it will not look harmonious. We want now an harmonious result, and this is why we are looking into field treatments. And that's what the Tixel is all about. Now, I'm going to tell you how Tixel fits into my clinic. And again, I have a clinic with a lot of devices: RFs, microfocused ultrasound, ablative lasers, non-ablative lasers. But still, I have 3 Tixel devices. I have 3 clinics. In each and one of them, I have Tixel, because Tixel is one of my favorite devices in the last couple 2-3 years. So we all know what is the Tixel. This is the titanium tip that doesn't penetrate the skin, transfers direct heat into the skin. So we create small, very special microchannels. We will speak about that later. And this causes the renewal of collagen. So just a few words about the technology. I will keep that fast because you heard a lot about that. So this is how the tip looks. This is a gold-plated copper plate, and as I showed you before, it doesn't penetrate the skin, but it pushes the skin to a certain amount of time, which we control, which we decide. So what's the advantages of the Tixel? First of all, it's a quick treatment. I like quick treatments. Why? Because the patients do not suffer for a long time, and we are very busy clinics, especially now when we cannot crowd the patients together. So a patient comes in and comes out, comes in and comes out. And this is a short and effective treatment. I do the whole face. If I do only Tixel, it takes approximately 15-20 minutes. Usually we don't need topical anesthesia. The second advantage is this is a minimally invasive, a non-invasive treatment. Yes, it can be ablative. Yes, I can use the Tixel also in very high parameters and convert it into a CO2 laser. But I don't need the Tixel for that. I need the Tixel in the exact niche of effective but non-aggressive. Because for aggressive treatments, I have a lot of other devices which are the golden standard for many, many years. And for the non-ablative technologies, I do have a lot of quite good non-ablative, fractional non-ablative lasers too. But this Tixel gives me something very, very unique. It's in between the non-ablative and the real ablatives. Of course, it's versatile. You can be totally non-ablative and you can be very strong ablative with a lot of downtime. But in my opinion, the great thing about the Tixel is that it is in the exact niche of effective but not aggressive. Okay, so we have been talking about transdermal delivery for a long, long time. This is not something new in the Tixel era, but what's new in the pores of the Tixel? We have clean and dry pores. We have no fume, so we perforate the skin very, very gently. So we have less pain, less downtime, less side effect. That's what our patients are looking for. And moreover, these are dry micropores, so we don't have all those fibrin and all this liquid that blocks the tunnel. The transdermal delivery in dry tunnels is much more effective. So the transdermal perforation and delivery would be much, much effective if you compare it to other ablative devices. So this is how the dry micropores, the craters, look like. And again, we have a direct conduction to the skin. We see that the longer the tip touches the skin, it will penetrate deeper, of course. And again, one very unique thing to that tip is that the high temperature of 400 Celsius is only at the surface of the skin, and it drops quite strongly as we go deep into the skin. So that means less pain and less risk for side effects and less downtime. So why do we need the 400 degrees? We already spoke about. This is the temperature that we need in order to break the skin, to perforate the skin, and this is upon references. So what's the difference between Tixel and CO2 laser, or Tixel and fractional ablative RF? First of all, the heat transfer in Tixel is more gradual. Okay, we have, as I've shown you before, it rises to 400, but it drops very, very quickly. Moreover, we have no carbonization, we have no explosion. So it means instead of explosive effects, we have vaporization, as you can see here in the slide in front of you. So we have dry pore, and moreover, the downtime is shorter, the pain is a lot less, and the risk for PIH is almost non-existent with Tixel in the correct parameter. So, as I told you, it can be very versatile, ablative, non-ablative. Of course, you can see here in histology that the longer you keep the tip in the skin, the longer the time it will get more ablative. No carbonization, we spoke about it. So what's the difference between CO2 laser? So Tixel is gentler to the skin, but still you get good results. For some indications, such as acne scars or stretch marks or even wrinkles, We thought that if we be more aggressive, we get better results faster. But we know now from experience that even if we take a patient with acne scars and we perform CO2 procedures, we need to do a series of treatment until we get good results. So if we can get more or less the same result, but without 10 days or 7 days of downtime and pain and PIH and staying at home, so why be so aggressive? And also compared to RF, the Tixel energy is the Tixel energy transfer is much lower than RF and laser. The Tixel is a very simple device. I like simple devices. I am a simple doctor. I am not a scientist. I want to give good treatment to my patient and I want to keep it simple. So we need to play with two parameters. The milliseconds, which is the time that the tip touches the skin, and the microns, which is this is the protrusion, how deep the tip will protrude the skin. Of course, you can do one pass or double pass. Usually we do one pass, one pulse. You can change it between the options. So, as I said, we can control the exposure time and the protrusion and the number of pulses. Usually I do one pulse and I usually do two passes. Okay, so as I told you before, it can be ablative or non-ablative. These are the parameters which the company tells us to use. My recommendation is usually I'm working either at 8,300 or 10,400 or 10 or 10,500. This is what I'm usually, this is my parameter. So if I have a very dark skin, I will start with 8,300. On a regular basis, I start either at 10,400 or 8,400. In the forehead or around the eyes, I lower the parameters usually. If I'm treating acne scars, then I would do either 10,400 or 12,500. These are my settings. So we can see that as we higher the time that the tip touches the skin, it will penetrate deeper and wider. And of course, we spoke about the special pores of the special microchannels of the Tixel, which are dry because we evaporate the skin. So the Tixel decomposes the stratum corneum and evaporates water from the upper layer. So we have open channels but dry, so we don't have the intercellular fluid from the cells to close them, to occlude them. And that's why if we apply an active substance on the skin, it will penetrate directly into the skin and it will not have to overcome the barrier of the fluid that blocks the channel. And again, this is how the Tixel works. It evaporates the skin. We have a dry microchannel. We apply an active substance and it penetrates in a good way compared to other ablative devices into the skin. So we can use almost any cosmetic product or drugs or any products with which we think will help the indications, and I will show you just a little bit. And now we will move on to the most, I think, interesting part is the way how I use the Tixel. Again, I have attended few seminars with Tixel, with Novoxel, and the Tixel is a very versatile and unique device that every doctor uses it a little bit differently. And to every doctor, it fits a little bit differently into a different niche. So I'm going to share with you the way the Tixel fits my clinic. So, as I told you before, our patients today are mainly looking for non-aggressive treatments, we see that this aesthetic market is huge. And yes, we see that a substantial amount of our patients want to improve the fine wrinkles and the texture, which the Tixel can give, can help us with. And we can see that more than before, our patients today really are not interested in ablative and painful treatment. They want office procedure, they want lunchtime procedure, they want to come to do the treatment, to go home, and to the day after to be there in their regular routine and not stay at home. And this is why I like the Tixel. Moreover, I can treat with it a lot of indications. I'm not doing the dry eye. I'm a dermatologist, so I stick to the dermatological indication. And you can see here we have a long list of indications that Tixel can treat. So this is a very cost-effective device because we can use one device to treat a lot of indication. The price is a lot cheaper than lasers. Usually lasers, you need a special device for every indication or for every family of indication, and the consumables are a lot cheaper because it's not a laser rod. So the advantages of Tixel, the ROI is very high. We have almost no disposable. This is a small device that I can carry very easily in a bag, in a carry-on from a clinic to clinic. It's not like a laser that we cannot move it because it's very gentle. This device, we can quite easily move it from a room to room, from a clinic to clinic. We can treat multiple indications and it can treat almost all skin types. So we spoke about that. So let's see some before and afters with Tixel. So of course we can use a Tixel as a stand-alone treatment. You can see this is an older lady with quite a reduction in the skin quality. So the Tixel, because it's a very gentle treatment, the way I use it, it doesn't mean it doesn't help when you have a relatively big reduction in the skin quality, because you see the good results. And for acne scars, yes, this is only after 2 treatments. So yes, we can use the Tixel as a stand-alone modality. Of course, it can be used for a lot of indications, for acne and for acne scars. As you can see here, we get very nice and fast results. But again, my favorite thing is the combination. So how do I combine Tixel? To tell you the secret, in one word, easy, very, very easy, because Tixel can be combined with almost all the technologies that I have, and it also makes the rationale. And I'm going to show you now a few of my favorite bestsellers or my favorite combinations. So one of my favorite combinations is the combination of Tixel with Skin Booster. And actually, we have conducted a small study almost 2 years ago, and the idea is to combine Tixel and Skin Booster. And the idea is to improve the skin texture and tone from 2 different mechanisms. So that's why 1 and 1 will not be 2. We have a synergistic effect, and that's the rationale of combination. Every time we combine, usually we get better results because the treatment have a synergistic effect. So the protocol is injection of 2 cc of Skin Booster, which is a cross-link. This is small particle size HA by Galderma. Now almost all the companies have a product for texture because they realize how important it is to improve the texture. So I inject 1 cc and 1 cc to each face. I am not injecting the forehead, and then followed immediately but by 1 treatment of Tixel, and a month after another treatment of Tixel. So again, when we are talking about the skin quality and texture, what does it mean? It means basically to improve the overall appearance of the skin. Because if you take a look on a 20-year-old girl, and if you take a look on a 40, 50-year-old woman who lives in a sunny area, you can see that the skin looks drier. it loses its vitality, its radiance. We have a little bit of pigmentary changes. We have surface roughness. We have a little bit of wrinkling. And if we improve this, the overall look improves. And that's what this treatment is all about. So just a few words about the skin booster. Take a look, for example, on this lady. You see that the face and the neck do not correlate to each other. She had a facelift, the face is good. We can't see very nicely the texture of the skin, but let's say it's okay. But the neck look a lot older. We want proportion, and that's why we can use the Tixel and the skin booster to this area and also to the face. So the skin booster is injecting the small particle HA to an area. It improves the roughness, it reduces the roughness, it improves the elasticity of the skin. We will not talk about the syringe. We have references regarding the injection technique is like that. And I'm going to show you the way I inject. And the idea again is not to inject it as a filler, but rather as a field therapy to improve, to stretch the skin. And that's the way I'm injecting. You can either use a cannula. When I'm treating acne scars, usually I prefer to use a cannula because I want to slightly dissect the skin. I want to separate those collagen fibrotic fibers to improve the scars. But when I'm treating only for skin rejuvenation, we can use it either with a needle in a short linear technique or with a cannula. And immediately after, so this is 1 cc to every cheek, and immediately after the Tixel, let's see some results. So neck. I am a big fan of neck treatment. We cannot be aggressive when we are treating necks. We cannot use very aggressive technologies when we are treating neck, and it's not very effective. So combinations for neck is crucial. And take a look at this man. He's a pilot. He's 65 years old, and take and see how nice improvement in this woman. Neck is really something that we see the age. I think that everybody should treat necks because it's a very simple, very technical treatment with very nice results. You can also improve the skin quality. You see, this is a patient with acne scars to improve the quality and the tone of the skin. A little bit of scars, a little bit of wrinkles, as you can see here. This is a very versatile combination. We can also combine it. In the beginning, I did the skin booster with fractional RF, and then I added 2 treatments of Tixel. Take a look at this lady with skin boosters and Tixel. This is dermatitis artefacta, a kind of acne scars. Very nice result. Again, this versatile treatment. So the way I do it is first I inject, and then immediately after I do the Tixel. I showed you my parameters. I perform the regular parameters, tone and texture, the same combination, tone and texture. The décolleté is also a very problematic area. We have a lot of demand in our country for the décolleté treatment because this is an area with a very thin skin. This is a very delicate skin. We cannot be aggressive. We all know the potential of scarring and keloids in this area, so we cannot be aggressive. So that's why I'm using combinations, and I really like Tixel because look of the improvement of the tone of the skin, and of course for the hands. So the Tixel is a very versatile device: face, neck, chest, hands. And this is my combination. I use it mainly for the face, for skin rejuvenation. Of course, you can also use it for the neck, for the chest, and for the back of the hands. And this combination is also good for acne scars, as I showed you. So just to conclude, this is one of my favorite combinations. I really think with almost only 2 sessions, one session I do the skin boosters and the first Tixel, and the second session I do the only Tixel. Almost in all the patients, you see some results. Of course, if we're treating acne scars, we need more sessions, but the patients see very nice results fast after 2 sessions. And now they have they want to continue because they are motivated to continue the treatment. Another combinations which I really like, as I told you, I really like devices. So This is a clear skin, which I can also combine it with Tixel. You can combine also the skin booster and the clear skin and the Tixel in the same session. So if I'm doing the erbium glass, which is a 1540 nanometer non-ablative, fractional non-ablative device, which I'm using, you first do the erbium glass and then you do the Tixel in the same session. The idea, the rationale is doing the deeper treatment and then the more superficial treatment and the less aggressive treatment followed by the more aggressive treatment. You can see here the indication that I'm using it. This is the same patient. This is the picture before, and then in the beginning I did only skin booster and clear skin, and then I did skin booster and Tixel. Another combination which I really like is Alma Q, which is a fractional non-ablative 1064 nanometer laser with skin booster and Tixel. So what's the rationale? The Tixel, I do it for the more superficial part of the skin. The Q-switch and the YAG, it penetrates deep into the dermis, so it will help me to improve those pinpoint scars, that ice pick scars that I see, because it penetrates, and this is the photoacoustic effect, and of course the skin booster. So you can see very nice results after one treatment. So this is my protocol, and these are the indications that I'm using it for. Skin rejuvenation, you can also use it for acne and acne scars, and of course for stretch marks, which are a sort of a scar. So how do I perform this combination? First of all, I do the 1064. This is the deeper treatment, but the less aggressive treatment. Then I'm doing the skin booster, and then I'm doing the Tixel. Why do I inject and then I do the Tixel? Because I don't want to inject after the skin, the superficial layer of the skin, the epidermis, is already not intact. So I think this is the best way to do it. Another combination of Tixel and Alma Q. This is a fractional non-ablative Q-switch 1064. You can see this is a very severe case of acne scars. So if she would have gone to my colleagues, maybe he would offer her a series of CO2 treatments or a series with fractional RF treatment, and the downtime and the pain and the risk for PIH is much higher. Here I combine the fractional 1064, which is a non-painful, non-ablative treatment with no downtime, and Tixel with a day downtime. So 1064 immediately followed by Tixel. This can be a good combination for skin rejuvenation, for acne scars, and for stretch marks. Of course, I'm not going to go into the topicals and into the drug delivery, because this is the baby of my dearest colleague, Ophir Arzi, and I know that we had a brilliant webinar just a few days ago, so I will not get into it, but just few examples. We can treat a lot of indications using the amazing drug delivery potential of the Tixel. You can see here, and again, I've been using a lot the tranexamic acid and the Tixel for melasma with great results. So I'm going to finish off with one of my favorite patients. Take a look at this patient. She came to me. She was looking for something for the neck and the jawline. Take a look at her. She has a little bit of skin laxity. She has a total loss of the contour of the lower part of the face, and she has a big reduction in the skin quality of the neck. And again, this is the patient. So this is the treatment plan. As I said, combination planning, we need to target few indications because aging is multifactorial. We cannot only treat the skin. So I have treated the skin laxity. Let's go to see the treatment. First of all, I treated the skin laxity with micro-focused ultrasound, and I did it for the lower part of the face, for the jawline, and for the neck. Immediately after, I injected an HA filler for the jawline to contour better the jawline. And then immediately after, the injection of the skin booster to the neck, because you see that the neck is, she has a long neck with a relatively pronounced reduction in the skin quality of the neck. So you see we've created better definition. This is immediately after the injection, better definition of the jawline. And then we move over to the Tixel. These are the parameters, the exact parameters that I'm using. When I'm doing combinations, I'm always using the lower side of the parameters, especially on the neck. So you can see micro-focused ultrasound on the neck. I cool a little bit the skin. Then I inject, and then immediately followed by the Tixel treatment, as you can see here. So, did the treatment work? Yes. These are the results after 1 month. Of course, it will take a longer time until we see the final results because we are triggering a creation of new collagen and also the microfocus ultrasound and the Tixel. This is a process. This is not a one-shot treatment. You cannot see the full-blown result after 1 month, but you definitely see that we have a very nice improvement. I really like this combination of skin booster and Tixel for the neck. I think it's amazing. So after the treatment with Tixel is really, really easy. You don't need a lot of post-treatment things to do. Usually I put a calming mask because it really helps to reduce the erythema, and that's almost that. So just to conclude, I think the Tixel, although we have a lot of devices in the market, and also I have a lot of devices in the clinic, in my clinic, Tixel is something which is very unique. First of all, it's very cost effective. Second of all, it's very safe, but effective. Again, this golden balance between effective but safe. I want to be effective but not aggressive. And this is the tango that I'm dancing with my patients. And to that dance exactly, the Tixel fits. And it also helps me to treat wide range of indication. Also the perioral and the periorbital areas. A lot of patients has those barcode wrinkles. You don't have a lot of options for these patients, so Tixel is a good option. The periorbital area, we cannot go close with the laser, or we can, but it's more complicated. So the Tixel is a very good device for the face, for the neck, for the delicate areas, for a lot of indications. And again, it is a versatile device, low risk for side effects. Don't be afraid. In the beginning, I was afraid. 400 Celsius on the face. I was afraid to use it. I was afraid of side effects. So that's why I started slowly. But now I cannot do without Tixel. And again, just a summary of few of my combinations. Of course, almost any combination, if it's rational to you, is possible. Just keep the correct order. And that's it. Thank you very much. And my take-home message for you is use Tixel, buy Tixel, combine Tixel. I think that today we cannot do everything with one device. We need to combine. I'm a big, big, big fan of combinations because I really believe it gives you better outcome. So Tixel is a very good device to combine with. It gets good results. It's a very good device for the beginner doctor because you cannot do a lot of harm with this device, and this is important. And that's it. Thank you very much. And now I will try my best to answer a few of your questions. Let's see. Okay, I need my glasses. Okay. So darkest, I'm going to read the questions and I'm going to answer with my voice. Okay, I'm not going to write the answer. That's okay with you, Erez? Okay. Do darker skin tone, Fitzpatrick type 3 to 5, get post-inflammatory hyperpigmentation after Tixel? If yes, how do you prevent or treat it? So, uh, we have a lot of darker skin types in my clinic. Of course, 3 and 4, no problem whatsoever. If I have a really, it's also safe to treat skin type Fitzpatrick type 5. But if I have a patient with melasma or a tendency to hyperpigmentary to PIH, so of course before the Tixel you can do like 1 week of Kligman formula of hydroquinone. I use 4% usually, but usually you don't need it. If you keep the low settings, if you don't scratch the skin afterwards, you're safe. Second question, since Tixel does drug-assisted delivery, have you tried diluted skin booster after Tixel with no injection? And the answer is no. I didn't try. We thought about it, but since the injection, I tell you something. I think that the level of the Tixel and the level of the injection is not the same level, the way I'm using it. Because I told you, I'm using the Tixel in the lower set of parameters. So I'm injecting the skin booster to mid-dermis. And I don't think that it will penetrate the same way, but I don't have any experience with that. I do the injection to the deep dermis, and then on top of that, I perform the Tixel for the more superficial part of the dermis and the epidermis. And what I usually apply after is either mesotherapy to see an immediate response, because improvement of I want to see immediate response of the skin quality, because with skin booster, it takes between a month and 2 months to see the full-blown result. Okay, another question. How much do you charge for a combination tick? Okay. I'm not cheap. I charge a lot of money. It depends, of course, if the combination is device and device or device with skin booster, because usually when I'm injecting a skin booster, so it's 2 syringes. So I charge separately for the syringe, and I charge the skin booster syringe as I charge any other syringe. I think that's the way everybody should do, because it lasts the same. It's better, so nobody should give a damn if I buy it a little bit higher or a little bit cheaper or higher price. It gives a very, very good result, and it's better for the patient that a syringe is a syringe. Now, for devices, usually I charge between, I don't know how to convert it into dollars, between 1,500 in our currency to 2,000 per treatment for a combination of devices. Erez, you want to tell me how much this is in dollars or in euros? Because you can use the currency. It's about $500. Of course, if a patient is doing a series of treatments, so usually I give 1 treatment for free. My way of doing it is not reducing the prices unless I have a very, old the patients that go with me for a long time, and now after the COVID era, I do give a lot of discounts, but these are my regular prices. Usually it's better to give a treatment for free rather than to lower the price, because then the lower price is in the patient's head and you can never change it. I don't see, wait. Okay, last, I don't know how to move down the questions. Wait. Oh, okay. Why to inject before treatment? Okay, why to inject before the Tixel? and not after, because the Tixel, it perforates the superficial part of the epidermis, and it's a lot painful to inject to a bruised skin. Moreover, as I just explained, I inject the skin booster deeper, and the way you do it, the correct way to do it is to start from the deeper treatment and go to the more superficial layer and not the other way around. But this is not something written in stone, and maybe you can do it also the other way around. This is the way I'm using it. Tranexamic acid, this is a new player in our arena for hyperpigmentation. This is anticoagulant, a drug that has been used for a totally different use in medicine, but there are few publications that it can also improve melasma, so that's why I'm doing it. Another question: have you done Tixel combination with? I don't know what's Rejuan. I'm sorry. DNA salmon. I don't know this product. So maybe you can specify a little bit, and I can see if I can answer. Okay, another question. Does the heat from the Tixel affect the outcome of the skin boosters? As you mentioned, that you could inject the skin booster first, then the Tixel. Okay. So the question is, if the heat of the Tixel doesn't melt the HA? Well, the answer is big no. It doesn't melt the HA. And this has two answers. First of all, during the production of the HA, in the sterilization or in the cleaning or whatever, during the process of the HA preparation, it goes under a very high high degrees. I lost the word. The HA is resistant to a very high degrees of Celsius, because in the production, this is what it goes through. So we have references that HA doesn't melt when you hit the skin, because the HA is there. So even if I do the treatment a month after, 2 months after, 3 months after, 4 months after, the HA is still there. So the reason not to do it together is that because you bruise a little bit the skin after skin booster, and you have a little bit of edema after Tixel, it will have a little more edema if you combine the treatment. So if I have a very, very, very delicate skin, I might not combine those two treatments together. But in a regular skin, which is not very thin, which is not very old, yes, you can combine together. Moreover, the Tixel, the temperature of the Tixel, as I showed you in one of the first slides, drops very fast between the superficial layer of the skin, which is there 400 degrees, and as it goes deep into the skin, it drops very fast. So 400 degrees is not what you get in the deep dermis, and that's where I inject the skin booster. So this is a multi-layer treatment. Okay. Next question. When you are using skin booster, is this the single treatment or a series? If I'm using skin booster as a skin booster alone, you mean you can use only skin boosters. Usually I'm injecting 2 cc's in one setting, as I told you, and it depends on the indication and on the skin condition. It can be enough. For skin rejuvenation, usually it's enough. Should I apply mask immediately to reduce redness after Tixel treatment? Yes, I do that. You can also apply a calming cream. I definitely use those masks. Yeah, you should take it into consideration in the consumables, but it's not a must. Does the heat do not harm the skin boosters? Well, the answer is no. Okay, Quencha answered. Okay. Should I use the electroporation? All device? Combined skin booster after Tixel treatment? I'm not sure I understand which device you refer to. I'm sorry about that, doctor. I don't know what is the call device, but it seems rational that you can use it, but I'm not sure which device it is. So I think I've answered all the questions. Thank you very much, everybody. I really enjoyed, and I really thank you for joining me. And I hope that you have a safe going back to routine very, very soon. So bye bye. See you soon.